Kevin Langley is 30 years old and over the course of a couple of weeks has lost about 10 pounds, even though he has been hungry and eating more than normal.
I'm always thirsty.
Okay.
I'm drinking like a case of these a day, and I got to keep one by my bed. I got to get up every couple hours at night and pee. My stomach, it really hurts.
Okay. Okay, Mr. Langley, I'm going to go and talk to your doctor, and I'm going to have him come in and see you right away.
Betty Sanborn, aged 55, has an appointment to see a nurse practitioner. She is just coming in for a routine checkup and appointment for mammography.
Well, your blood pressure is 174/96. That's quite a bit higher than it was last year.
Well, high blood pressure kind of runs in my family.
Okay. How are you feeling in general? Has there been any problems, any change in the way you feel?
Actually, come to think of it, I've been a little tired lately. Not as peppy as I used to be. I've got an infection in my leg here, and it won't go away.
Okay.
And my eyeglasses, my eyesight is changing. My eyeglasses don't seem to help. Some days they do, and some days they don't.
Well, Miss Sanborn, I would like to do a blood test to check for your blood sugar today, okay?
Both Kevin Langley and Betty Sanborn have been diagnosed as having diabetes mellitus, a common disease affecting 6% of the U.S. population. Mr. Langley has type 1 diabetes mellitus, and Mrs. Sanborn has type 2. The American Diabetes Association criteria for a diagnosis of either type 1 or type 2 diabetes may be any of the following. First, a fasting plasma glucose at or above 126 milligrams per deciliter after no caloric intake for at least 8 hours. Second, a fasting plasma glucose at or above 200 milligrams per deciliter at any time of the day without regard to the time since the last meal and symptoms of diabetes. And third, a plasma glucose at or above 200 milligrams per deciliter at the 2-hour mark during an oral glucose tolerance test. Each of these tests must be confirmed on a subsequent day by any of the 3 methods. Let's begin by discussing type 1 diabetes, the disease Kevin Langley has developed. In general, only about 5 to 10% of those with diabetes have type 1. These individuals have destruction of the beta cells of the pancreas, which affects their secretion of insulin. Ultimately, this destruction is so complete that the beta cells do not secrete any insulin at all. In general, this destruction is an autoimmune response. That is, the body's system for combating infection instead attacks a part of the body, in this case, the beta cells of the pancreas. There is some genetic predisposition to type 1 diabetes, but it is low compared to type 2. The highest incidence of type 1 is in Caucasians. Environmental factors, particularly viruses, are thought to be a contributing factor. Usually, those who develop type 1 diabetes are young, children or young adults, although the disorder can occur at any age. The peak age is between 12 and 14. Signs and symptoms develop rather abruptly, usually over a period of a few weeks, although destruction of the beta cells can begin years earlier. The signs and symptoms are primarily due to the elevated blood glucose. Because the glucose cannot enter the cells, it remains in the extracellular space, exerting an osmotic pressure. This pressure causes water to leave the cells and enter the extracellular space. As a result, the cells become dehydrated. Also, when the blood glucose level rises above a certain threshold, a significant portion of the excess glucose spills into the urine and is excreted. This loss of glucose in the urine causes the person to lose a massive amount of fluid in the urine as well, because the osmotic pressure exerted by the glucose in the renal tubule prevents fluid reabsorption. The usual signs and symptoms include weight loss,
Well, I'm really hungry all the time.
polyphagia, or excessive eating as a result of excessive hunger due to the lack of glucose inside cells and the caloric loss of glucose in the urine, polydipsia, or excessive thirst due to cellular dehydration,
I got to get up every couple hours at night and pee.
and polyuria, increased urinary output due to osmotic diuresis.
I'm always tired,
Okay.
and my eyes get kind of blurry.
Lack of energy and sleepiness may also occur because of the diminished utilization of glucose for energy and high levels of glucose in the brain. High glucose levels can cause blurred vision due to swelling of the lens. If type 1 diabetes is left untreated, there is a metabolic shift from using carbohydrates for energy to burning fats for fuel for body functions, and symptoms such as abdominal pain, nausea, and vomiting occur. All this can lead to ketoacidosis and coma, and sometimes death. Ketoacidosis is most often found in persons with type 1 diabetes because they lack insulin. To prevent complications such as ketoacidosis, persons with type 1 diabetes must take injections of exogenous or manufactured insulin daily in order to compensate for the lack of endogenous insulin produced by the pancreas. To review, those who develop type 1 diabetes, usually younger Caucasian individuals who have some genetic predisposition to the disease, have destruction of the beta cells of the pancreas, probably as a result of an autoimmune response. Characteristic signs and symptoms of type 1 diabetes include weight loss, polyphagia, polydipsia, polyuria, lack of energy, sleepiness, and blurred vision. Now let's examine type 2 diabetes mellitus, the type Betty Sanborn has. The great majority of individuals with diabetes, 90% or more, have type 2, and about 1 in 3 are not aware that they have the disease. In general, it is more common in individuals over 40 and is especially common in those who are overweight or obese and sedentary. However, there has been a recent epidemic of this so-called adult disease in children. Many believe that type 2 diabetes is now more common in children than type 1. There is a strong genetic predisposition to type 2 diabetes. A large percentage of individuals with type 2 have family members with the disease. The prevalence of type 2 is greater in some ethnic groups than others. African Americans, Native Americans, Latinos, and Pacific Islanders have a much higher incidence of diabetes than Caucasians. Women who have a history of gestational diabetes also have a very high risk of developing type 2 diabetes 5 to 10 years after the pregnancy, especially if they remain overweight after the pregnancy. Although many people mistakenly believe that type 2 diabetes is a less severe form than type 1, the truth is that both type 1 and type 2 diabetes are chronic, progressive, metabolic illnesses that, if left untreated, may cause serious complications. In the past decade, with an increase in the incidence of people who are overweight and obese, there has been a 30% increase in the prevalence of diabetes mellitus type 2, with the most dramatic increases seen in people in their 30s. Also contributing to this increase is a sedentary lifestyle, the advancing age of the United States population, and improved methods of screening and diagnosing diabetes. It is estimated that 18 million persons in the U.S. now have diabetes, most of them having type 2. It is no wonder many healthcare professionals refer to diabetes type 2 as an epidemic. In general, type 2 diabetes is due to different factors than type 1. The dysfunction in glucose regulation is due to the combined effects of decreased insulin production by the beta cells of the pancreas and insulin resistance by the body's tissues. There are two theories about how these problems develop. One is that a defect in beta cells causes the pancreas to secrete less insulin, resulting in hyperglycemia or high blood glucose levels. Over time, the ongoing hyperglycemia causes tissues in the muscles and liver to become insulin resistant. The second theory proposes that the initial problem is insulin resistance in muscle tissues, fat cells, and the liver. As a result, the beta cells increase insulin secretion to keep blood glucose in a normal range. However, over time, the beta cells are unable to keep up with demand and lose their ability to produce sufficient insulin. Whichever problem begins the process, the result is the same as for type 1 diabetes. Glucose builds up in the bloodstream, and the body cannot use its main source of fuel effectively. Recent research has focused on a constellation of abnormalities called metabolic syndrome, previously called Syndrome X. It is estimated that up to 1 in 4 Americans has this syndrome, and it is strongly associated with type 2 diabetes. People with the metabolic syndrome are usually overweight or obese, especially around the waist, and have an increased amount of intra-abdominal fat in this area, which some researchers believe causes their tissues to become increasingly resistant to the effects of insulin. As a result, the pancreas produces and secretes more insulin, which over time may exhaust the beta cells. The cluster of disorders that characterize the metabolic syndrome is thought to be caused by these pathologic changes. Those with the metabolic syndrome have high blood pressure, abnormal blood lipids, increased fasting blood glucose levels, high triglycerides and low HDL, and several disorders in blood clotting that make it easier to form clots in blood vessels. In addition to having an increased risk of developing type 2 diabetes, persons with metabolic syndrome are at a high risk for developing cardiovascular disease. Let's review this section. Type 2 diabetes is a chronic, progressive disease that affects the great majority of those with diabetes. It is more common in those over 40, who are overweight, sedentary, are members of certain ethnic groups, have a family history of the disease, or have the metabolic syndrome. The dysfunction in glucose regulation is due to decreased insulin production by the beta cells and/or increased insulin resistance in muscle tissues in the liver. The signs and symptoms of type 2 diabetes are not nearly as dramatic as those for type 1. In fact, the average person with type 2 has the disease for 7 or more years before diagnosis and may not present with symptoms or signs of the disease. As a result, high blood glucose levels have damaged blood vessels and caused serious complications long before the person even knows she has diabetes. Some of the signs and symptoms of type 2 diabetes are similar to those with type 1 and include polyphagia, polydipsia, blurred vision, fatigue, frequent infections, and slow wound healing. Because the blood glucose is high, microorganisms can flourish. In some individuals, frequent infections or a wound that won't heal prompts them to see a doctor, and a subsequent diagnosis of type 2 diabetes is made. In women with type 2 diabetes, certain infections, such as Monnelia or yeast infections, caused by the organism Candida albicans, are more common. Some individuals with type 2 diabetes can be treated with diet and exercise. Often, however, as the disease progresses, they will usually require a combination of oral agents or oral agents and insulin in addition to the diet and exercise. If the hyperglycemia of type 2 diabetes is not diagnosed and treated and results in dangerously high blood glucose levels, the resultant dehydration may lead to an extremely serious condition called hyperosmolar hypoglycemic state. As you have seen, type 2 diabetes is a progressive disease and may cause damage to the heart and circulatory system even before the person is diagnosed. Of great concern to public health professionals, then, is the estimated 16 million people who have a condition called prediabetes, formerly called impaired glucose tolerance. In prediabetes, the blood glucose level, measured by certain tests, is abnormally high, but less than the level indicating diabetes. It is estimated that most people with prediabetes will develop type 2 diabetes within 10 years if there is no intervention. Although those with prediabetes may have some cardiovascular disease, they can prevent further harm and the development of diabetes through lifestyle changes, such as decreasing the total number of carbohydrates or the concentration of carbohydrates they eat at one time to put less stress on the pancreas, increasing their amount of exercise, and losing weight. A 5 to 10% reduction in total body weight with an increase in exercise and activity can produce a significant reduction in the progression to type 2 diabetes. Some motivated individuals can even return their elevated blood glucose levels back to the normal range. Thus, the progression to diabetes is not always inevitable and can be reversed by behavioral changes, a fact that healthcare professionals need to convey to the patients and the public at large. The long-term complications of inadequately treated diabetes, either type 1 or type 2, are many and can be devastating. When persons have diabetes, the risk of heart disease and stroke are increased by 2 to 4 times. Uncontrolled diabetes causes an eye disease called retinopathy, which is the leading cause of blindness in the United States and responsible for 12% of all new cases of adult blindness. Type 1 and type 2 diabetes can result in a kidney disease called nephropathy. This often causes the kidneys to fail and the person to require dialysis and kidney transplantation. 40% of new cases of end-stage renal disease are the result of uncontrolled diabetes. Damage to the nervous system, or neuropathy, occurs as well and affects over 50% of those who have diabetes. Although neuropathy can affect any region of the body, it is most commonly seen in the legs, feet, and hands. This is called peripheral neuropathy and is caused by blood vessel and nerve damage that may lead to ulceration and infection of the lower extremities. This, in turn, may lead to subsequent amputations. More than half of all non-traumatic amputations of the legs and feet are the result of complications such as foot ulcers associated with uncontrolled diabetes. Diabetes, either type 1 or type 2, is a very serious disease, and people suffering from it require close monitoring, teaching, and guidance to avoid or forestall complications. Let's review one more time. The signs and symptoms of type 2 diabetes develop more slowly than with type 1, and prediabetes, or impaired glucose tolerance, often precedes it by many years. Both type 1 and type 2 diabetes affect many body tissues with damage that is long-term and severe. The risk of heart disease and stroke is increased with diabetes. Other complications associated with diabetes are retinopathy, nephropathy, and neuropathy. By understanding the origin and pathophysiology of type 1 and type 2 diabetes, nurses have the foundation for counseling patients in the areas of prevention and management of their diabetes.